So the main reasons that Shannex was interested in developing an academic partnership with Dalhousie University are that there aren't very many new health professionals coming out of their training programs interested in working in long-term care. It's typically not the most desired sector for new and emerging health professionals to practice in. Those that do come to us in the long-term care sector have often had minimal practical training in terms of care of the elderly. So opening the Maplestone doors was to really give learners an opportunity to provide care of the elderly in a long-term care setting and be exposed to the benefits that come from working in this kind of an environment. Models of care across the long-term care sector are also changing. We wanted to be putting learners through this program at the Collaborative Learning Centre who were able to collaborate with one another once they finish their training programs. Health professionals are being asked to work together and to collaborate in a variety of different and new ways in long-term care, so preparing them for this would mean effective and collaborative health professionals coming out at the end of their training. Finally, the opportunity to capitalize and partner with a university partner really gives Shannex the opportunity to bring in the latest research, the latest innovative practices in order to enhance our client care and service delivery as much as possible. The outcomes that we've seen in this building as a result of the partnership have been quite significant. We've seen a significant impact on both our clients and their families, as well as on our staff in the building. The 9 a.m. team meetings, which I believe Anne has talked about, were initiated as a result of this academic partnership with Dalhousie. These occur for just 15 minutes on each morning that there's a physician in the building, and every single individual who is a part of that team attends. From housekeeping to registered nursing to pharmacy to the physician to personal care workers, administration, dietetics, the whole team is in that room. Just this 15 minutes with the opportunity for all of the team to discuss client care results in more comprehensive client care planning and decision making. There's also a greater number of services available on site for our clients. Two examples in particular are audiology and speech-language pathology. These are not services that are publicly funded within the long-term care sector in Nova Scotia. So having partnerships with the schools that train audiology and SLP students has meant access to both of these services for all 87 Maplestone clients on site. The impact on staff has also been significant. The 9 a.m. team meetings in particular have meant that each individual team member sees that their contribution to the care of our clients is equally as valued as anyone else's. And I think this has been an absolutely invaluable addition to the building. There's also been increased opportunities for learning and development for all of our staff members. So there are teachable moments with them throughout the course of the day because of the academic faculty that are in the building and the learners that are there as well. So staff members that have worked at Maplestone for 30-35 years or maybe just 2 to 3 years all have access to increased learning opportunities as a result of this partnership. So overall, Shannex has been extremely pleased with the impact that this has had, primarily on our clients and their families and also on our staff. And we're really looking forward to see where this can go over the next few years.